Thank you very much for inviting me to speak today. My name is Emily Pieracci. I realize that as I think I'm probably the only regulator in the room, I'm probably the least popular person, but I do want to reassure you guys, first and foremost, I am a veterinarian and an animal lover, so I hope that that can build some goodwill. So today I'm going to provide some background and history about CDC's role in the regulation of dogs. I'm going to discuss some of the diseases of concern, provide a brief summary of the elements of CDC's new dog regulation, and explain how we got to this point and why CDC chose the requirements that it did. While I don't expect everyone in the room to agree with our decisions, I do hope that everyone can leave today with an appreciation of the depth and complexity that we are facing in the dog importation world. So first, a little background. CDC estimates that there are roughly 1 million dogs that are imported into the United States every year. 700,000 of those dogs come by airplane, and roughly 100,000 are from countries where dog rabies still exists. And CDC refers to these countries as high-risk countries, and they're shown on this map in blue. CDC's previous regulation had minimal entry requirements for dogs and cats, and the regulation had not been updated since 1956. It required that dogs and cats appear healthy on arrival. That was it for cats. Nothing else was needed. Importers of dogs did have to show proof of vaccination against rabies if the dog was coming from a high-risk country. Dogs cannot be vaccinated against rabies until they're at least 12 weeks of age. And then they have to wait an additional 28 days for that vaccine to take an effect before they can enter the US. And so that meant that puppies under 4 months of age could not be imported into the US under the old regulations. So importers would present fraudulent documentation where the animal's age and vaccination status was misstated in an attempt to be able to import very young dogs, often for commercial purposes. This led to a large number of dogs being denied entry, with notable increases during the COVID-19 pandemic, when people were working from home and a lot of people were looking to adopt a pet. The COVID-19 pandemic created a boom in the dog retail business, and overseas sellers really took advantage of the demand for dogs in the US. The lack of health checks of imported dogs, due to the fact that US governments were focused on the pandemic, meant that the risk of disease importation was very high. CDC also documented numerous challenges with airlines housing dogs in unsafe conditions that resulted in the illness and death of multiple dogs. The US lacked animal care facilities near many airports that could work with airlines to safely house and care for dogs during long layovers or while dogs awaited admissibility determinations. And all of these issues converged during the COVID-19 pandemic when both CDC, state, and local health departments did not have the capacity to address these issues while also responding to the pandemic. And so in July of 2021, CDC issued a temporary suspension, which I'm sure you guys are all familiar with, as an emergency measure to limit the importation of dogs from high-risk countries, knowing that a longer-term solution was going to be needed. During the temporary suspension, CDC did provide pathways for travelers to import dogs from high-risk countries. We did this, by developing an import permit system and identifying animal care facilities near several airports that were willing to partner with CDC, the USDA, and Customs and Border Protection to ensure the safe importation of dogs into the US. During the suspension, all dogs that arrived from high-risk countries had to be healthy, they had to be at least 6 months of age, and they had to be microchipped. Commercial importers also had to make a reservation at one of the animal care facilities so that we could examine and vaccinate all commercial imports before allowing them into the US. The suspension did reduce the number of dogs denied entry. The suspension also allowed us to determine what was working well and what needed to be adjusted moving forward. It was helpful in reducing the number of dogs denied entry through the use of this import permit system and the establishment of the animal care facilities, or ACFs as we call them, at several ports of entry that could screen, vaccinate, and quarantine any dogs that needed care. What we weren't really sure of was whether the suspension was really working to deter the importation of dogs from high-risk countries that were ineligible for entry because they weren't 6 months of age or they weren't vaccinated against rabies, or whether it simply increased their movement from high-risk countries to rabies-free countries before entering the US in order to circumvent US entry requirements. And unfortunately, we were able to look at some unpublished data from Customs and Border Protection, and we do believe that dogs under 6 months of age were simply moved from high-risk countries to rabies-free countries, making them harder to detect on arrival. And this is when the need for a universal age requirement for all dogs began to be discussed by the CDC. Having no requirements for dogs from rabies-free countries was creating a dangerous loophole. And unfortunately, we documented numerous times during the suspension when importers misrepresented the purpose of the importation, commercial versus personal pet, or the age or health status of their animal. I think you guys are all aware there are a lot of financial incentives that unfortunately serve to discourage honest representation and reporting within this industry. So some of the lessons that we learned during the suspension that helped inform our final rule. One of the first things we recognized is that we as an agency do not have sufficient personnel or resources to continue a permit program. In addition, there is a high likelihood of falsified documentation when a paper-based system is the only thing you have in place. We also recognize that standardized forms and standardized entry requirements reduced errors, especially by third parties like Customs and Border Protection and airlines, who are responsible for enforcing those requirements. We also noted that dogs need a safe place to be housed near airports if they need medical care or if they need a safe place to rest and get some food and water and a break before they continue onward travel. And we need to be able to ensure that foreign vaccinated dogs are healthy, that they don't pose a public health risk, and we recognize that vaccine certificates alone are not sufficient to guarantee an animal is healthy, unfortunately. And so what this meant long-term for our regulation was that we did eliminate our permit program. Wherever possible, we introduced the use of standardized forms, age, and microchip requirements. And we did require specifically that all foreign vaccinated dogs from high-risk countries have to enter through a port with an animal care facility so that we could ensure that those animals are examined on arrival and given a high-quality vaccine that we know protects against rabies. So while CDC regulates the importation of dogs to prevent the reintroduction of dog rabies, which was eliminated in the US in 2007, rabies is not the only imported disease of concern. There are numerous zoonotic, vector-borne, and foreign animal diseases that can be carried by or transmitted by dogs to humans, domestic pets, livestock, and wildlife. Prior to the suspension, there was limited to no health checks or screening of dogs on arrival in the US. And as I mentioned, there were no animal care facilities in the US, which made it difficult to provide prompt care and attention for pets that arrived and needed that medical care or screening. While rabies is the only disease that in dogs that is required to be reported to CDC, we have had all of these diseases shown here on the slide, either found by CDC on arrival or reported to us by state health departments shortly after dogs arrive. And this is just a list I compiled from the last 2 to 3 years. Now, prior to the suspension and the new regulation, there really wasn't a system in place to detect, respond, and report these diseases. And that's why our partnerships with the animal care facilities are so crucial moving forward, is that is our real-time system on the ground to catch these ill dogs as they come in before they enter our US communities. The loophole here is that we still don't have requirements for dogs from rabies-free countries. So while we are likely to catch instances of illness in dogs arriving from high-risk rabies countries, there's still a lot of dogs that come from countries where diseases like leishmaniasis are endemic, and those dogs are not getting screened if they're also coming from a country that's considered free of rabies. So I'm going to talk about some of these diseases in a little bit more detail, and we're going to start with rabies because this is my favorite. It's a weird thing to have a favorite of. So dog rabies still exists in more than 100 countries around the world, and it's responsible for roughly 59,000 human deaths every year There are multiple variants or strains of the rabies virus that circulate in different animal hosts. DMRVV, or dog-mediated rabies virus variant, is the strain that circulates in domestic dogs, and it's the strain that's responsible for those 59,000 human deaths. Since 2000, there have been 7 DMRVV infected dogs that were imported into the US. The US has a robust surveillance network, and we were able to rapidly identify these 7 events, and thankfully none of them resulted in sustained transmission cycles in US dogs or in human cases. But they all required extensive public health investigations to track and identify the people that were exposed to these dogs that needed to receive post-exposure prophylaxis, and to identify the animals that were exposed to these dogs and needed to undergo vaccination and quarantine. Now, we used to have a very high background level of vaccination in most of the US dog population, which helps to serve as a barrier against this disease. But there is a rise in vaccine hesitancy within the United States, and rates of rabies vaccination coverage in dogs has been reported to be on the decline, which creates a vulnerable US population in which the risk of rabies reintroduction is increasing. And this makes it all the more important to ensure that dogs that are coming into our country, especially those from high-risk countries, are adequately vaccinated against rabies before entering our US communities. So this is a sad, but I think relevant case example. So in June of 2021, this little cutie in the photo, his name is Alfie. He's a 5-month-old mixed breed dog that arrived in the US from Azerbaijan. This is a photo of him after he was picked up at the Chicago O'Hare International Airport. He was driven to Pennsylvania with his adoptive family. 3 days after arriving, he began to show signs consistent with rabies. He was taken to a local vet where he was euthanized after suffering seizures and sudden cardiac arrest. The Pennsylvania State Lab and CDC were able to confirm rabies virus in this dog. And CDC was able to strain type and confirm that it is a strain of dog rabies that is found in the Caucasus Mountain regions near Georgia and Azerbaijan. This was a very difficult case because the remaining rescue animals that were shipped with this dog, there were 32 in total, were shipped to 9 different states very quickly on arrival. So this was actually the largest public health outbreak investigation that we've ever had to do for a rabid dog import. We had to have assistance from more than 10 state health departments to track down and identify all these rescue animals that had been scattered across the US, and then also follow up with every person who had come in contact with these dogs since they arrived. We were scouring gas stations along routes from Pennsylvania to Kentucky because we had dogs that were driven down there. It took us weeks, and it was a literal nightmare. Additionally, one of the things that we did was we took blood samples from all the dogs in this shipment. We were able to locate them across 10 different states, and the state health departments went in and took blood samples from these dogs. And what we did was we tested those blood samples to see whether or not these dogs had been previously vaccinated against rabies. Now, they all had valid rabies vaccination certificates on entry. But 7, or close to a quarter of the dogs in this shipment, did not pass the blood test, which means they had not been vaccinated against rabies prior to arriving. But the rescue group swore up and down that they had been vaccinated, and so we started a very in-depth evaluation with the vaccine manufacturer. They conducted a forensic investigation of the vaccine product and the labels, and they did not find any issues with the vaccine lot. So what that means is that there was no problem with the vaccine that these animals were reported to have received. CDC took all the paperwork we got from these animals. We looked at their veterinary clinic history, the vaccine manufacturer, the lot numbers, any information on that rabies vaccination certificate, and we compared it to the test results that we got from each of these animals. And what we found was that there was a high likelihood of vaccine failure if a dog had been vaccinated at a specific vet clinic A. And that suggested that there was a problem with either vaccine handling or storage or administration of that vaccine within that vet clinic. And after many conversations with the rescue group, they were actually able to confirm that what was happening was that they had a young veterinary intern that was new in that clinic who had been underdosing the dogs. He had only been giving half doses of rabies vaccine. And so that was why so many of these dogs were not considered adequately vaccinated against rabies. Now, the rabies vaccination certificate requirements that CDC had in place, especially the lot numbers, the manufacturer, and the veterinary contact information, were really crucial in helping us identify what went wrong in this case. And this information is not always included on rabies vaccination certificates from other countries. And this is one of the reasons that CDC is a big proponent of using a standardized rabies vaccination or a standardized export health certificate form for any dog that's imported into the United States. So the next case I have is little Elaine. This was a very sad case. She's a 10-month-old French female bulldog. For those of you who are in the breeding industry, I think hopefully this will raise some concerns that a 10-month-old dog arrived pregnant in October of 2022 from Poland. She flew into Chicago, and midway on the flight, she aborted 3 fetuses. Now, she was in the cabin with a transporter who was not her owner, so he didn't know anything about her health history, didn't even know that she was pregnant. But he noticed that she was seeming to be in distress during the flight, and when he opened the carrier, he found 3 dead fetuses. 5 people, including 1 flight attendant who attempted to give mouth to snout to the aborted fetuses on the plane, were determined to have high-risk exposures. Now, Elaine was sent to an emergency veterinary clinic when she arrived. She passed a 4th stillborn puppy, and we ordered screening for brucellosis, and she came back positive for Brucella canis. Now, Elaine was being imported by a breeder specifically for the purpose of serving as breeding stock in her kennel. But as many of you breeders know, Brucella is very difficult to treat. Relapse can occur, and it is generally recommended to remove positive animals from breeding operations. And so the owner breeder elected to euthanize Elaine. This gets more complicated because Elaine traveled with a second companion named Faye. Faye was also a 10-month-old female French bulldog. She traveled in cargo, but she was from the same breeder in Poland, and she was also confirmed to be pregnant. But she was not as far along in her pregnancy as Elaine. And so when we talked to the breeder told us that Faye had been bred by the same male that bred Elaine. So immediately we started to get very concerned that Faye may also be infected because, as you guys know, Brucella is transmitted through contact with bodily fluids, including those that are passed during breeding. And so we were worried that she was also positive. The vet clinic that was housing her in Chicago did not have long-term quarantine capacity. Her owner was located in Florida. Although Faye tested negative 2 times, the concern was that oftentimes Brucella-positive dogs will not test positive until they've delivered their puppies. And so no state was willing to allow Faye to stay unless she was going to be placed in quarantine and have additional testing after the puppies were born. This was roughly $12,000 in cost that the breeder simply did not have. And so the breeder chose to return Faye to Poland. So we tested Faye right before her flight to make sure she was not potentially shedding bacteria before we put her on a plane. It was deeply disturbing to myself and everyone on the team that we basically were exporting this potentially Brucella-positive dog back to Poland, but there were no rules against that, and we couldn't leave her in Chicago, and we couldn't send her to Florida, and so we were feeling very much stuck between a rock and a hard place. So Faye was flown back to Poland, and 2 weeks later, I got a text message from her owner with a photo of her and all of her puppies, and she said, "She's safe here in Florida, and all the puppies are healthy." So she had simply flown her back to Poland, rebooked a flight with a different flight nanny, so that the lookout we had placed on her original flight nanny was now moot. We couldn't trace it. So she was flown, instead of into Chicago, into Miami, went right on to that breeding facility. I did text and asked her, did you test her? Have you tested the puppies? And she said, nope, they all look healthy. So this is some of the challenge that we face in trying to do follow-up. It's very difficult to track these dogs. When they come in, when they have a disease, when we're trying to send them back, we know that they're oftentimes just rerouted right back to the US with a different person.
What year was that?
2022. So Brucella canis is a bacteria. It's present globally. The true prevalence in dogs is unknown. There was a recent JAVMA article that mentioned that as many as 15% of dogs worldwide may be infected, with greater risk in free-roaming dog populations, such as those that some rescue organizations attempt to remove from the streets and adopt to families here in the US. It's transmitted through contact with infected bodily fluids, such as birthing fluids, like the one that the flight attendant probably was exposed to when she gave mouth to snout to the aborted fetuses. People that are infected with brucellosis can experience non-specific febrile illnesses. And that just means you feel like you have the flu. You don't feel very good. And so it can be really difficult to diagnose what is actually going on. So some people that get brucella do go on to experience very severe outcomes. Miscarriages are common, as well as heart and bone disease. So CDC conducted an investigation when the plane landed. We determined that 5 people had high-risk exposures to Elaine, the aborted fetuses or soiled bedding. And so given the potential severe human health outcomes, especially in women of childbearing age, CDC did issue a WHO alert to the government of Poland, requesting that they follow up with the 3 crew members who had been exposed. We recommended testing and monitoring. We also sent notifications via email to the airline, the crew, and the passengers on board who had come in contact with this dog. And then we notified the Indiana State Department of Health because that is where one of the passengers was reported to live. In addition to rabies and brucella, these are some other photos of dogs that have been imported in the last year, just kind of demonstrating the range of issues that we see at the ports. We've got dogs that come in with skin lesions, open wounds, eye and nasal discharge, come in paralyzed. We've had dogs with visceral and cutaneous leishmaniasis that have been imported, and dogs with multi-drug resistant bacterial infections as well. Every time a sick dog comes in, CDC has to investigate each case of illness in a dog to make sure that it does not present a public health risk. And then if it does, we have to work closely with state and local health departments to figure out what to do with these animals. And as you just heard in the case of brucellosis, a lot of times the states don't want these animals, and it's very difficult to find places where they can be safely housed, treated, cared for. And as part of Elaine's case, some animal rights folks got wind of the fact that we may be recommending euthanasia of Elaine, and it turns into a huge nightmare for us on a PR front. And so it's very difficult to implement public health measures when we've got a lot of folks on social media that are spreading misinformation. We certainly appreciate that some dogs do need to be imported for medical care, but there needs to be better communication between importers and US government agencies before the shipment of these animals occurs, so that we can make sure that when these animals arrive, they're taken to a hospital that, 1, is equipped to address their needs, 2, has appropriate infection prevention control measures in place for the staff at these hospitals, and 3, can prevent the spread of any potentially infectious diseases into our US communities. This is my last case example. I think this is kind of a nice one. So I think this is a great example of how our animal care facilities can help protect US communities moving forward. So this was a case in December of 2022. We had a little 8-month-old Maltese that arrived from the UAE. She was sent to the CDC Animal Care Facility for examination and revaccination, as was required during the temporary suspension. And when she got to the facility, they found a tick on her ear. So we submitted that tick to USDA's National Veterinary Services Laboratory, and they actually identified it as a foreign tick, Rhipicephalus kamikaze, which it's a great name for a tick, which interestingly had never been found in the US before and never been seen in the Western Hemisphere. So this was a really cool discovery, and normally this tick is found on hoofstock in desert climates, but we don't know the veterinary and human health impacts of this tick because it's relatively unknown and it's not commonly studied. And so this was a great example of the benefit of having these animal care facilities available to find these ticks, to find these illnesses in dogs, and be able to stop them from entering US communities. This dog was treated with an ectoparasite and was allowed to release for onward travel, so we didn't stop her travel, but we did stop the travel of that tick. CDC and USDA have since partnered on a project with the animal care facilities where we collect and identify every ectoparasite that is found on imported dogs. And to date, more than 75 ticks and sucking lice have been found on imported dogs, including 2 more species of Rhipicephalus kamikaze. So I think that this is a really cool project. The next phase of the project, we're going to be expanding it to take these ticks and undergo pathogen testing. So see if these ticks are actually carrying any infectious diseases that could harm people or animals here in the US. So this is a summary of the new regulation. It's just a very brief summary slide. And what it shows is that all dogs coming into the US need to be 6 months of age. They need to have a microchip, and they have to have a CDC dog import form, which is an online form that owners fill out before they arrive. Additional requirements for dogs depend on where the dog is traveling from, so high-risk country or rabies-free country, and where that dog was vaccinated against rabies, so a US vaccinated dog versus a foreign vaccinated dog. The regulation requires that foreign vaccinated dogs from high-risk countries have to come in through a port with an animal care facility where they undergo examination, revaccination, and quarantine if needed. And I think these requirements are really going to help detect illness and parasites to ensure that these dogs are adequately protected against rabies with high-quality vaccine that are known to be safe and effective before they are released into US communities. Now, despite publishing a notice of proposed rulemaking, getting a lot of comments, considering those comments, drafting responses to those comments, and publishing the final rule, we do still continue to get feedback on 4 particular aspects of the rule that I thought I would cover briefly before I end the talk today. So the first one is the age requirement, and I think many of you guys are familiar with that. So the reason that CDC chose 6 months is that it aligns more closely with the World Organization for Animal Health with their age requirement. They actually recommend that dogs coming from high-risk countries be at least 7 months of age in order to be imported to another country in the world. We worked with our rabies experts. We felt we could have a little bit of flexibility around that, and so we actually dropped the age requirement back to 6 months. But this allows time for vaccination, an adequate waiting period for that vaccine to take effect, a tighter, and then a tighter waiting period. So that pushes us out to 6 months. The difficulty is that there is no way for us to discern personal pet dogs from dogs that are imported for rescue, resale, or adoption. CDC and Customs and Border Protection have documented thousands of importers making false claims of ownership. We piloted a program during the temporary suspension that separated personal pets from commercial imports, and we found that there was over a 3%, or more than 3,000 people, that misrepresented themselves. And although 3% sounds small, what I want to stress is that we know that that is the absolute lowest number because we were inundated with permit requests. So we know we missed a whole bunch of people that were better at falsifying documents. The 3,000 we caught were the really obvious ones. We felt that a standardized age requirement would benefit dogs and people in several ways. The first is that we thought that it would help deter the sale and trafficking of young puppies from international puppy mills and other unscrupulous actors that work abroad to breed dogs and ship them into the US. It creates a safer transportation environment for puppies that are flown into the US. Puppies that are subjected to stress, cold and heat, noise, low oxygen levels during travel. All these stressed puppies are more likely to break with illness on arrival, which burdens our veterinary system, families that purchased or fostered or rescued these dogs, and it potentially introduces new and emerging diseases into the US. Standardized age requirements also, indirectly, promote local adoption and purchase of young puppies from US communities, many of which have shelters that are above capacity. It does stop importers from circumventing U.S. entry requirements by transiting dogs from high-risk countries into low-risk countries and then bringing them into the U.S. if those low-risk countries don't have an age standard. It does reduce the burden on federal and state agencies that have to investigate every case of illness and death in an imported dog, and there are a lot that we see in young puppies under 4 months of age. It also ensures that dogs that are vaccinated at 3 or 4 months of age have a sufficient waiting period and time to build immunity against rabies before they're exposed to the stress of transportation, which can dampen their immune system and the response to vaccination. The microchip feedback we got has been kind of interesting. Microchips are a form of permanent identification that allows veterinarians and health officials to verify that the paperwork presented with an animal matches or belongs to that animal. And so when you have a shipment of 4-year-old male yellow labs, how do you tell which one is which if you don't have a microchip? Collars can be easily switched, and so we need some form of permanent identification for us to feel confident that that paperwork matches that dog. Microchips are also an internationally recommended standard that align with the World Organization for Animal Health. They're also a tenet of responsible dog ownership according to the AVMA, the CVMA, the AKC, the CKC, and many other animal welfare organizations. While most organizations have supported this requirement for microchips, there have been a small number of outspoken individuals that have expressed displeasure over this requirement. We do hope that in time, people will see the immense benefits that microchips provide, but right now we are still receiving a lot of feedback. The feedback that we've gotten around animal care facilities so far mainly is that there are not enough of them and that they are too expensive. We currently have 7 facilities. The goal is for us to have 18 facilities, one at every port where we have a CDC Port Health Station. Those are the 18 busiest airports in the US and cover, I think, over 90% of international travel. So that is our long-term goal. The important thing to recognize here is that animal care facilities are privately owned facilities, so they set their own costs. They set their own prices. They are partnered with and they're regulated by CDC to provide health exams, vaccinations, and care for animals, and that's the component of this partnership that we really oversee, is how they're treating those animals, how they're reporting the diseases that they're finding in those animals, but we do not set pricing for them. The hope is that as more animal care facilities pop up, there will be more competition in pricing and the prices will come down over time. Quarantine is definitely the most expensive piece of this because a 28-day quarantine, those boarding costs can definitely add up. But quarantine is not required for all dogs. It's only required for dogs that do not have a titer prior to arrival. And CDC has also worked with our rabies branch experts to develop a post-arrival testing procedure that allows for a shortened quarantine period for qualified dogs. The final aspect is the government-endorsed veterinary certificate. So government-endorsed export health certificates are a current international standard. There is already an animal export system that exists worldwide to facilitate this requirement, and it does align with WOA standards. Now, CDC initially received pushback on this requirement specifically from Canada. And so we are working with Canada to discuss the issue of frequent border travel and the need to find a long-term solution. But it's really important that we have something in place because the 2019 rabid dog imported into the US flew into Canada and drove across our land border. So the risk of rabies coming across land borders is real. It has happened. As I mentioned earlier, the standardized requirements, especially the lot numbers, the manufacturer, the vet contact information, were really crucial in helping us identify what happened during that 2021 rabid dog importation case. And so having standardized vaccine and export health certificate documentation is really important moving forward so that we can do that contact tracing when we have future cases imported. The endorsement of the health certificate and the vaccine documents by a government official does provide a little bit of pre-arrival or pre-travel checks as well. It allows veterinarians in the exporting country to take responsibility for the animals that they are exporting to the US, and it also provides legal protections and options for the US government to be able to go back and follow up with foreign countries when we do have documented forged vaccine certificates or export health certificates. Before I end, this is just a resource page. I'm sure many of you have probably seen it, but if you want to know more about our rules or regulations, you can go to cdc.gov/dog travel, and it links to all of these other web pages. I just want to thank Patty and NAIA for inviting me to speak today.